In a rural region of 9 towns, the North Quabbin Community Coalition faced a daunting question in the early days of the pandemic. How could they bring life-saving information and vaccines to a community still waiting for access?
When it was originally released, we were struggling with how our rural region was going to be able to access not only the COVID vaccination itself, but also information. So it was literally hindering quality of life.
The coalition moved quickly, repurposing staff roles and building mobile outreach clinics rooted in trusted relationships.
Some of the first steps that we took was looked at our internal structure of our organization to see whose staff time we could dedicate to kind of getting the word out, to looking at campaigning, and to help us do some concrete setting up of some tangible clinic kind of work. We didn't want to recreate the wheel. We wanted to go where people were and where our most vulnerable people were and be able to bring this to them right where they were at and then spread the word.
As partnerships grew, so did the reach and the trust.
We had first responders, we had the hospital system providing the original dose of the vaccine, we had community-based organizations volunteering and being the people who sat with the folks. And those relationships built during the clinics carried forward.
What began as a vaccination campaign became something more, an invitation to talk about equity, access, and who was being left behind.
One of the major milestones was that this funding gave us the leverage to start those conversations. We were able to launch a task force that looked at real discrepancies about parts of our community that were not receiving things, health inequities, things that, we look really homogenous to look at our demographics, but we're not. So then it let us formalize a task force structure and kind of mobilize that we're going to move forward looking specifically at some of these discrepancies and really focus on equity and inclusion in our region, thanks to this funding.
There were unexpected discoveries, both painful and powerful.
How political all of this conversation became and how truly divided our community is around the political lines. And it really puts in jeopardy some of the teaching that we do around public health and public safety. This funding has helped to hold the table for those conversations, even if we disagree.
And when they looked closely, a clearer picture of rural health disparities emerged.
Rural, mostly Caucasian men in their 20s were the ones really not receiving either the information or the vaccination, and why, trying to figure that out.
With a staff of just 3, NQCC relied on powerful partnerships to serve 9 distinct towns.
We could not do any of the work we do without our collaborating partners. There's just so much give and take that comes through our partnerships. And we serve 9 towns of the North Quabbin region. In reality, each town is so different, so unique. And so really having the ability to dive in, work with our individual boards of health and different select boards, different, community champions that kind of step forward depending on what town it was, really helped us to lead these conversations and to ultimately put some of those clinics in place.
Beyond COVID-19, the coalition's work expanded to meet housing, climate, and recovery needs, guided by the same community-led spirit.
That this is really funding for a response to quality of life improvement, not just better specific COVID health outcomes. This is general health and wellness outcomes. And this funding just captured the ability for those small organizations to take a small amount of money and really give us that bang for our buck.
In North Quabbin, the greatest impact wasn't just in the numbers, it was in the relationships built, the inequities uncovered, and the infrastructure left behind.
The investment into work like this is just immeasurable. But at the end of the day, people are relying on relationships. And they believe most Dr. Mom, Dr. Facebook, Dr. who they reached out to that gave them the best advice. And locally, we have these awesome structures built in already. So this funding helped to identify those internal structures that existed and really helped to get What is the most important thing for the people of this community?
This is the rural effect, where care takes root and change grows from within.